Okay. What of the following congenital anomalies is most commonly associated with the use of valproic acid during pregnancy? A 24-year-old woman with epilepsy is planning to become pregnant. She is currently taking valproic acid to manage her seizures. She is concerned about potential teratogenic effects with her medication of the fetus. What of the following congenital anomalies is most commonly associated with the use of valproic acid during pregnancy? I don't think that you could really just like determine this one, but I always associate. So I do think there's not really a diagnosis here. I just think it's a fact, right?
Okay.
Um,
Yeah.
and so my gut thinking is neural tube defects.
Okay.
And I'm gonna get rid of. I can go ahead and take away pulmonary hyperplasia and renal agenesis. Those are both symptoms of Turner syndrome. And I do not believe this causes anything with tetralogy of Fallot, how you pronounce that. And it could be cleft palate, but I would go with neural tube defects.
Yeah, it's actually neurotube defects. So let's talk about this a little bit. So the best way I remember this in particular is that what do pregnant women need to take supplemental wise to help with neurotube defects?
Is it B9?
It's folate actually, folic acid.
Yes, that's yeah, B9.
Oh yeah, yeah, B9. Yeah, sorry. Like I said,
No,
I'm like I can't remember the B's. Yeah, you're 100% right. Yeah, you're right. B9 is folic acid, right? And so valproic acid messes with folic acid.
Oh,
Yeah,
okay,
and that's why that's how I remember it, right? If valproic acid messes with folic acid, then of course you're gonna have neurotube defects. So you don't have to memorize anything. You know what I'm trying to say?
for sure.
Okay, and then pulmonary hyperplasia, renal agenesis, tetralogy of flow. Renal agenesis, I think it like deals with your blood pressure medications that are diuretic, like lisinopril and things like that. So they're gonna have
Mm,
you memorize that. Cleft lip and cleft palate. Those are dealing with syndromes. I can't remember if there's any drugs that can give you that, but mostly those are syndromic kids or it's spontaneous mutations. So not too much drug related. Tetralogy Fallot, I don't remember which drugs can cause that, but yeah, these are kind of your associations that you want to remember with teratogenic drugs since they like to ask them.
yeah, I'm actually really bad at these. When I get these questions on MD Boost, I do bad. But
Yeah.
yeah, this is a good one.
Yep. Just keep, like I said, adding little bits of, these a little bit more memorized based. And I hate, calling things memorization because a lot of the questions aren't memorization. It's more about understanding clinical, but there is a portion of medicine that will always still